Greetings, faculty members, friends, and family. My name is Teddy Lee. Before I start us off with my poster, I would like to talk about patients who are admitted into the hospital for infection. The outcomes of patients with an infection range greatly from recovery in just a few days to developing life-threatening conditions such as sepsis. Sepsis is a condition that is well known yet still poorly understood, as symptoms of sepsis can be very heterogeneous. Therefore, it is super important for clinicians to be able to prioritize care to those who are at the most risk of developing sepsis. We conducted a systematic review and meta-analysis with the objective in comparing quick sequential sepsis-related organ failure assessment, or QSOFA, the systematic inflammatory response criteria, or SIRS criteria, the sequential organ failure assessment, or SOFA, and the National Early Warning Score, or NEWS, in predicting mortality in adult patients with suspected infection. On the center left of the poster, you can find that our review included 35 studies with a total of more than 400,000 patients. Mortality was defined differently in these studies, including 28-day mortality, 30-day mortality, but most of them being in-hospital mortality. These three types were pulled together in our analysis, but subgroup analysis where in-hospital mortality was assessed separately was also performed. Most of these studies took place in the emergency department, which is not unusual, but some studies assessed these scoring systems in the setting of hospital wards or the ICU as well. You can find our main results on the right, where our hierarchical summary receiver operating characteristic curves, or HSROC curves, are shown. These plots might look complicated, but the main idea is that the y-axis is ordered by increasing sensitivity and x-axis is ordered by decreasing specificity. Each circle there represents the sensitivity and specificity value of an individual study, and the black dot is the summary pooled estimates of sensitivity and specificity of all the studies. The 95% confidence region is indicated by the region encircled by a dashed line. If the dashed region is more to the upper right of the figure, it means that the scoring system has a higher sensitivity but lower specificity. In contrast, if the dashed region is more on the lower left, it means the scoring system has a lower sensitivity but much higher specificity. Beneath these plots is table 3, where we have put down the numerical value of the summary estimates of sensitivity, specificity, diagnostic odds ratio, and positive and negative likelihood ratios. I certainly hope that you may find these comparisons helpful. To conclude, QSOFA has a poor sensitivity, but has the highest specificity for predicting mortality among adult patients with suspected infection. In case you wanted to look at more detailed results, you may scan the QR code provided at the bottom of the poster.